Hello, Skogman team. My name is Rick Jedlicka. I've had the good fortune of working with you for a number of years on your benefit offerings, the different plans you have to pick from. This is open enrollment, so I'm going to spend some time today going over your medical plan. I hope that the EASE platform that we're using this year for your enrollment is going fairly smoothly. I think it's fairly straightforward, but obviously there can be questions, and so I don't want you to hesitate to reach out to Heather and or myself. You can get a hold of her, she can get a hold of me, or you can call me directly. We can try to answer your questions. The medical plan we're going to review is the same plan as what it was last year, and the pricing is the same as what it was last year. So we're going to look at the medical plan here, and we're going to talk about how the coverage works. And you're going to see my cursor is moving here as we go up and down the slide. But the medical plan for the upcoming renewal in July is with the Blue Cross Blue Shield family. It's a well-marked Blue Cross Blue Shield product. The network that the plan encompasses is their Alliance Select PPO. And what that means is it's a national network of hospitals and doctors, allowing you to really receive care anywhere that you need to in the United States. So obviously the hospitals here in Eastern Iowa and the doctors in Eastern Iowa are all in this network. In addition to that, you can really travel anywhere you want for care. So if you want to drive up to Rochester, Minnesota to the Mayo Clinic, you're covered there. If you get on a plane and fly to Houston or Cleveland to one of the cancer centers, there's coverage there. If you're traveling on vacation and you're in Colorado and you get a bad sinus infection, you're covered just like you're here. So it's really, truly a open-ended, go anywhere you want for care, and you're going to be in network. Plans like the one you have offer a deductible that is your expense before the insurance company pays any claims. Now, deductibles on plans like this apply for procedures. So obviously inpatient care at the hospital, anything that would be outpatient care, whether that's at the hospital or at a surgical center, those are all going to have deductibles. Occasionally something at the doctor's office like a lab. So if they draw blood and they send it off to the laboratory, that can come back and be applied to your deductible. Okay, the deductible follows the calendar year and starts in January, and your plan has a $2,500 single deductible. There's a $7,500 family deductible, but everybody in your household has an individual $2,500 deductible. I'm going to use an example in a minute that'll explain that in more detail. After the deductible, we pay what's called co-insurance, and that's paying an additional amount of the remaining bill until we get to what's called an out-of-pocket maximum. And your out-of-pocket maximum on your plan for single is $5,000, and the most your family as a whole would ever pay in a calendar year is $12,000. So we're going to run through a couple scenarios. So if I were to end up having an appendicitis attack and I went into the hospital and they put me in the hospital as an inpatient setting and they took my appendix out, I'd be responsible for the first $2,500 of that bill. After the $2,500, I'm still going to have to pay 40% of the remaining bill. But if my 40% totals another $2,500, I've then paid $2,500 in deductible, $2,500 in co-insurance, and I've met my out-of-pocket maximum, and my costs for that year then are complete, and I don't pay anything the rest of the year for my care. That is my maximum exposure. Following that, if my wife were to get injured, maybe she broke her leg and had to go in and have her leg set at the hospital, she has a set $2,500 deductible as well, 40% co-insurance to $5,000. But independently from me, she has hers, and together then we've paid $5,000 of our $7,500. But the illustration basically says if my appendix ruptures and I have my wife insured or my children insured, I don't have to meet the $7,500. I just have $2,500 in single deductible. So that's how that works. Preventative care basically is your annual physical. That's provided to you at no cost. We want you to get that physical every year, okay? And we're going to do that for you for free. So schedule that and go in and have that done. Other preventative care that are covered, anything that's deemed preventative is billed at no charge to you. So ladies getting an annual exam at their OBGYN doctor also will have that procedure for free. Anything that's preventative is zero cost copays, okay? If I need to go see my doctor at the doctor's office, there's a separate charge for that that does not have a deductible. So office copays for a primary care physician, that's what PCP stands for. That's your family doctor. Your primary care physician doctor is going to be a $35 copay. Doesn't matter how often you go, okay? Doesn't matter what they charge you, the most you're going to pay is $35. If you need to see a specialist, it's going to be a $70 copay. So if I need to see a cardiologist, or if I have a knee replacement and I have to do follow-up visits with my surgeon, those are going to be $70 copays. But again, no deductible for that. So it's a flat fee, okay? If I go to a urgent care center at 9 o'clock at night, I go to Mercy Care North, 95% of the time it's going to be a $35 copay because most of the physicians there are family doctors or general practitioners. Occasionally there is a specialist that's on call there, and if it is, you may have to pay $70, but most of the time it's going to be a $35 copay. If you use our virtual office visit, the doctor's on demand virtual visit, that's a $35 copay all the time. Okay, so that's the online tool that we have available to you to be able to receive care over the phone. Okay, so you push the button on the app, the doctor comes on the screen, you visit with them, they can look at you visually, okay, on the screen, and that's a $35 copay. The emergency room is kind of unique. It actually has a copay of $250. Okay, so I cut my thumb, I go in the emergency room, they stitch me up, they send me home, it's a $250 cost. The interesting thing about the emergency room is occasionally when we get to the emergency room, we are billed beyond the scope of an ER visit. And I'll use my thumb as the example. So I cut my thumb and I go to the emergency room. If they look at my thumb and they say, well, you've cut the tendon in your thumb, and the emergency room doctor says, I have to call a hand specialist to come in and fix that because I don't know how to fix that the proper way. The hand specialist doesn't work for the emergency room. They work for the hospital. Okay, that's going to have a deductible applied to that portion of the bill. So occasionally somebody goes in the emergency room and they're billed beyond the scope of the $250, and that's why. Okay, the other example I always use with the emergency room is in the event that I go in with some chest pains and they say, well, Rick, we believe you're okay, but we're going to keep you overnight for observation. The $250 that I pay for the emergency room gets applied to my $2,500 deductible because now I am an inpatient at the hospital. I'm actually receiving care in that facility, so I'm going to have a deductible, but they don't double dip. They don't take the $250 and then charge me again starting at $0 to get to $2,500. They give me credit for that. The drug card that comes along with this plan, okay, has different tiers based on the type of medicine that you're receiving. So where it says RX copays, there's some numbers in there. $8 are tier 1. We normally call those generic medicines. Okay, 92% of all the medication administered right now has a generic equivalent. We want you to take generics when you can, okay, because they're less expensive for you and less expensive for the insurance company. But the generic medicines don't have a deductible. Anything beyond a generic, so a brand name, a preferred brand, a specialty med, those are going to have a deductible. Now, it's not this big $2,500 deductible at the top. It's a separate deductible per calendar year of $100 for single, $200 for family. So if I need to get a tier, what we call a tier 3, 1, 2, 3, a tier 3 would be a $50 copay. If I need a tier 3 medicine, I'm going to pay the first $100. And after that, then I'm only going to pay $50 for that script every time I get it filled. That's how that works, okay? The monthly cost associated with your medical plan, $84 for a single. Single plus spouse is $310. Single plus children with no spouse is $290. And then if you're insuring your entire family, we're going to deduct $450 out of your monthly paycheck, okay? Those are monthly fees. So that's how much you're going to be charged. The Skogman company is picking up the difference between what is billed and that amount, and that number is exactly the same as it was last year or the current year we're in now before the July renewal. So that covers your medical plan.